Hey guys, Dr. Coyle coming to you once again from the Coyle Institute, and today I want to talk about something that is very common that women suffer from, but also something that's not common at all, but is a major issue when it does happen. How many of you guys struggle with constipation? I am sure a lot of you guys do. There are multiple reasons why women struggle with constipation. But one of the crazy reasons why women suffer from constipation is actually a condition called rectal prolapse. Rectal prolapse is not the same as a rectocele. So there's a little bit of a difference there. So a lot of people think, well, a rectocele is the same. But no, a rectocele is where there's a herniation in the bottom part of the vagina that bulges up into the vagina. That can cause constipation. But a rectal prolapse is actually where the rectal tube, that's what we call it, it actually comes out through the anus. The way that most women figure out that they have this is they've been struggling with constipation for a long time. They're sitting on the toilet, and next thing you know, they actually feel something inside them come out. And most of the time when somebody comes to me that is complaining about having something down there, like, I don't know what this is, doc, but usually, thank goodness for modern technology and cell phones, most ladies will take a picture of it and they'll come in and say, see, I have something down there. Typically, it looks like this red, fleshy, beefy thing that is coming out through the anus. That is rectal prolapse. Traditionally, this has been treated by colorectal surgeons. However, as urogynecologists, we also deal with really anything in the pelvis. Obviously, we work with people that have severe constipation. Sometimes women that have that severe constipation will also have this rectal prolapse. There's been a lot of different procedures prescribed or used to treat that. However, here at Coyle Institute, we have the most minimally invasive approach to repairing rectal prolapse. It's called a ventral rectopexy, done minimally invasive. So you come into the office, we evaluate you, we determine that's exactly what's going on with you, and then we can set you up for a minimally invasive procedure to repair your rectal prolapse and get you back to enjoying life and spending the time with your family that you should be spending instead of spending time on the toilet. If you are feeling like you have something going on like that, or if you have severe constipation and you don't want to get to that point, don't hesitate. Give us a call here at Coyle Institute and we'll be happy to take care of you. Have a wonderful day.